you all, if virtually, to the Rockefeller Institute of Government. My name is Leigh Wedenoja, and I'm Senior Policy Analyst here at the Institute. Today's webinar, Employment Support and Information Ecosystem for Individuals with Disabilities, is part of a larger series of webinars, discussions, forums, and reports delving into the relationship between benefits eligibility and the employment choices of people with disabilities in New York. This series is sponsored by NYSID and the New York Alliance for Inclusion and Innovation. The Rockefeller Institute has a long history of research into the employment of people with disabilities in New York, as well as the employment of the direct support professionals who work with them. I'd like to thank Maureen O'Brien, President and CEO of NYSID, and Michael Seawriter, President and CEO of the New York Alliance, for the opportunity to work on this research project this year. So in addition to the forum series, we also published a policy brief called Navigating the Benefits Cliff, which you will see a link to in the notes. This walks through eligibility rules, work incentives, and work disincentives of social safety net programs for people with disabilities. I'm going to start with a little bit of housekeeping. So first, this webinar is being recorded and will be available both on the Institute's YouTube channel as well as the Institute's website, both for those who are unable to attend right now or for anyone you'd like to share this information with later. Recordings of our previous two webinars in this series, Navigating Benefits and Employment and The Cost of Paperwork, are also currently available. Each of our panelists will take part in a 10-minute moderated discussion followed by a shared Q&A. Please submit any questions you have using the Q&A tool. This is located at the bottom of your screen. And in addition to today's webinar, we have one more forum in January, Policy Solutions at the local, state, and federal level. This will be at the Rockefeller Institute on Tuesday, January 9th, from 12 to 1:30 p.m., where we'll examine policy solutions brought forth by other states, localities, federal programs, and have a general policy discussion about some of the issues we're going to talk about today. So without further ado, I'd like to introduce today's moderator, Steve Towler. Steve serves as Vice President for Programs and Business Development at AHRC New York City chapter. Steve has over 35 years of experience developing employment and training programs for people with disabilities and at youth risk. Welcome, Steve. I will now turn the forum over to you.
Thank you very much. I'd also like to share that I'm a board member both on the NYSID board and on the New York Alliance board, and really excited about the opportunities that our associations have been able to work with Rockefeller to kind of move the field forward in some very, very important ways. So excited to be here today. We really have a really good panel kind of in store. I'm going to give you a little bit of the webinar overview. And in our collective pursuit of inclusivity and empowerment, we recognize there are really an array of professionals who are involved in the field to help people prepare for work, obtain jobs, and maintain jobs in the community. And oftentimes benefits can be an issue related to this. So each kind of professional brings a different set of skills to the table, and which are going to be helpful for people to navigate the system, to prepare, understand, what may or may not happen in their benefits situation once they kind of begin moving. It becomes evident that these professionals operate with different kinds of experience and knowledge, right? Which is a tricky part that we'll be getting into, I think, quite a bit today. The knowledge piece and where you can obtain the information to be a skilled benefits person is not that easy sometimes for people to obtain. The diversity, while valuable, can sometimes lead to confusion for individuals with disabilities and place really an additional burden on the service, right? So kind of being able to pull this all together becomes really critical. Our discussion today aims to spotlight the challenges these dedicated professionals face, and in turn, the individuals they serve. We'll explore the intricate web of information, training available to those involved in the process, seek opportunities for improvement, and look for ways to address the complexity. So we're going to try to get on with that and to be able to kind of find ways to help individuals with disabilities to kind of get the support and guidance so that they can be successful at work. It's really a critical piece. And we have four extremely knowledgeable panelists here today with us. I'm going to just kind of briefly mention who they are, and there'll be a little bit more in-depth kind of information about them as their turns come up. But we have Kerry Douglas-Duffy from the Department of Labor, Ann Gallagher from voc rehab side of things, and she's going to get into some good discussion. We have Gregory Sorrentino from the Center for Disability up in the Albany area, and Derick Bowers from Goodwill of New York and New Jersey, more of a downstate kind of focus, New York City kind of area. So when we begin thinking about what's happening in our world, and Leah mentioned the document that was put together on navigating the benefits cliff, there's a lot of really valuable information in there. So if you haven't had a chance to really take a look at this document, I think it's worth your while. It's a good read. It's well put together, and it'll give you some really interesting information. In New York State right now, there's 9.4 million people, working age individuals with disability, and only 6 million are working. All right. That is not enough, quite honestly. And what we're going to try to get into is kind of understanding what the benefits cliff even means, right? So it's more than just Medicaid and SSI and SSDI. There's more benefits kind of in the mix on this with that related to work. Oftentimes for people with intellectual and developmental disabilities, you're going to find the issues related to SSI and Medicaid become really, really big ones, depending on who the person is, a person returning to work, maybe it's an SSDI issue. Oftentimes they're complicated and challenging for people and individuals to really understand. So there's an intersection between, where the different benefits and employment choices really hit. And this is one of the things we want to be able to get to a little bit now, is how do people make these decisions about how much they want to work, how many hours they feel they can work, what's going to happen if I take a full-time job versus a part-time job, and just be able to kind of really put all the different pieces together that's going to really kind of help them prepare for this. So you could go on. There's hundreds of, really important pieces of information in here, but navigating the benefits landscape and avoiding that cliff can be difficult and confusing. And if the information's not really put together solidly and people don't have trust in what they're hearing, they sometimes will opt not to go to work because they're afraid, right? Or they'll opt not to take more hours because they're afraid. So these are some things that we want to be able to have a very kind of lively discussion on today. So I'm going to first turn this over to Kerry Douglas-Duffy. Kerry is the director of the Bureau of Workforce Innovation and Quality within the Division of Employment and Workforce Solutions at the New York State Department of Labor. As the director, she oversees the Bureau's operations, including Workforce Innovation and Opportunity Act, WIOA, implementation, policy development, grants, quality assurance, and contracts, workforce development, strategic planning, Office of Career Development Inclusion. I'm surprised you have time to be here today. There's so many things that you're covering here, right? Kind of with that. So if you could please, Kerry, kind of give us a little information about yourself and what your role is with the Department of Labor. Kerry?
Sure. So I'm the director of all of that, as Steve mentioned. Thank you, Steve. But I think the unit that relates to today is our career development and inclusion unit that I oversee, and have experts in that unit. So I'm actually not the expert, my staff really are, and they are joining me today in the audience, so they'll be here for answering any questions as well. Our career development and inclusion unit serves, we have special populations that we work with, reentry, older workers, youth, but we also have a disability unit. And within that unit, I'm going to talk a little bit today about our SION program and some fantastic programming that they have put together in the information that we have on our career centers. So I oversee WIOA, as you mentioned, the Workforce Information and Opportunity Act, and we're going to talk a little bit about that today, because that funding is what has been crucial to some of our services. You want me to go ahead and talk about our programming, or?
Yes, could you please?
Sure. All right. So I'm going to take about 10 minutes just to kind of go over our programming a little bit. So in October of 2021, Governor Hochul announced a commitment of $11.1 million in Federal Workforce Innovation Opportunity Act, which is the WIOA I mentioned. Governor set aside funding. So we get funding every year under WIOA. It's our largest funding process for the career centers, and we have a set aside funding. Governor Hochul set aside the funding to expand the capacity of the New York State career centers and surrounding workforce programs to serve individuals with disabilities, including those with developmental and intellectual disabilities, by funding the Disability Resource Coordinators, or DRCs, which I may reference back and forth today, in the local workforce development areas to make existing service delivery strategies more inclusive to people with disabilities, providing training and assistance to Career Center staff and partners to support improvements in training and employment outcomes for adults ages 18 and over with disabilities and promoting systems change. The project that we have is called the New York Systems Change and Inclusive Opportunities Network, or SCION. And it's administered here by the Department of Labor. This was huge for the Career Center Workforce Development System because up until now, with the SCION program, we had not had funding to support DRCs statewide. The term SCION is a gardening term, and it references or refers to the process of which a new plant can be grown out of the roots or stalks of an old one. As such, the New York SCION is a culmination of work under federal funding we received for the Disability Employment Initiative pilot and the Disability Program Navigator before that. The two initiatives sought to improve education, training, and employment opportunities and outcomes for youth, as well as adults with disabilities, but they were pilot programs. They were not statewide initiatives, and we couldn't always guarantee that we were going to get those grants. So the New York SCION program provides the same services as those pilots did, but it takes it to scale across the state. As under our DEI, our New York SCION DRCs, they're credentialed in work incentive counseling and benefits advisement to better serve Social Security Administration beneficiaries. They also promote the SSA Ticket to Work program, resulting in increased revenue for each local workforce development area, in which in turn, can leverage a better services for individuals with disabilities. We're actually going to start our third year of the SCION project in January of 2024, so we're excited about that. So far, we've had about 9,000 people with disabilities that have received training in Career Center services, and over 3,000 people have secured employment in the 15-month implementation period of SCION. The New York Center system provides employment services to all job seekers, including individuals with disabilities. Our services include career counseling, resume development, career workshops, computer and digital literacy, online training, classroom training, job search resources, and placement assistance. And people with disabilities can contact the Career Center directly to schedule appointments to get assistance that they need in finding jobs. The one thing about our services in a Career Center is people don't have to have an employment goal before they come to see us. We can actually help them develop that employment goal, do some career exploration, some career counseling, before going into employment. Through the New York Career Center Network, our customers can access the disability resource coordinators and partner agencies such as Access VR and the New York State Commission for the Blind, and additional services and support such as video remote interpretation and assistive technology are also made available. Disabled customers, they don't have to have a job goal, as I mentioned, which is nice. They can come in. We recommend that they schedule an appointment. It's always easier that way. Currently, we have 27 DRCs covering 26 local workforce areas in 26 counties statewide. And similar to voc rehab counselors, the DRCs guides individuals with disabilities through the workforce services programs they need to reach those employment goals. They assist individuals with disabilities to navigate the state's workforce system, which can be hard to go through sometimes. There's a lot of folks that we mentioned, a lot of different areas, people who help. So it's kind of figuring out who can help with when. Disabilities, the DRCs support the development of partnerships and collaborations that lead to people with disabilities partnering in education, training, employment opportunities. They conduct outreach to businesses and employers to promote hiring for people with disabilities. They provide benefit advisement and work incentive counseling to support the expansion of the Ticket to Work program statewide. And the New York SCION broadly supports the state level improvements in capacity building to improve accessibility and inclusivity in our career centers. Our career centers We're generalists in the career centers for the most part. They serve anybody who walks in the door. So having those DRCs in the Scion program really supports the career centers in serving people with disabilities. Staff, including VR counselors, job coaches, and benefit counselors, can connect with DRCs anytime, and we list them right on our website. As I mentioned before, the DRCs are trained benefit advisors and work incentive counselors. They can support the work development system and better serve individuals by helping job seekers to understand the SSA work incentives and how these incentives can help persons slowly transition off of benefits and turning that benefits cliff, as Steve mentioned, into more of a benefits path. They can explain public benefits, including the Social Security, disability insurance, supplemental security income, Medicare, Medicaid, any other federal benefits, and really the guidance provided by the DRCs. It's individualized, which is important. And that's to that individual's circumstances. DRCs create linkages with other agencies, and they can broker linkages and accommodations that may be needed. For assistive technology, for instance, they can work with other agencies and services to provide that service. They assist job seekers with disabilities to navigate, as I mentioned, the Career Center. They can also help with finding services, supports for housing, transportation, healthcare. They can, support the increase in collaboration with all of our WIOA partners. So as I mentioned, we work with Access VR and Commission for the Blind. There's other partners as well, so they can work all together. And they'll educate the businesses on reasonable accommodations. They connect to job seekers to the centers, making sure that they know about the centers, coordinate events, co-sponsor business education and training events, like labor law seminars, sessions on Americans with Disabilities Act. And one of the things that they've done is they've leveraged and teach the integrated resource teams kind of intervention, or IRTs. We found the IRT model to be really successful. The IRT brings together a team of diverse providers, including those community and WIOA partners, as I mentioned, like Access and Commission, together to help an individual plan, coordinate, and implement and work with the services. The IRT streamlines services throughout the cross agency, and it also supports really the provider, right? So if it's the rehab counselor, our DRCs, I think that planning and working together in a team environment is very supportive. One of the things that we also have, as I just mentioned earlier on, is we have the Office of Career Development and Inclusion in our special populations is our disability unit. It's comprised of a project coordinator and a state lead that provide technical assistance related to best practices, policies, and program implementation. The project coordinator monitors the state level policies and activities of the WIOA partners, and the state lead acts as a liaison to relay information and resources. And as I mentioned, Alan Gallagher, Amanda Quergas, and Kerry Wiley are attending today and can help out when we open up the chat. We also have a project advisory council that provides guidance on state trends, emerging needs, priority populations, including people who are deaf and hard of hearing, people with autism, and people who are over the age of 55. And the disability unit convenes bi-monthly technical assistance meetings that highlight effective program models and share activities for our WIOA partners. And then they also convene the first annual Disability Employment Summit in partnership with Columbia Green Workforce Development Board. That was really successful. They're going to plan to do another one in the summer of 2024. And they've held 4 sustainability forums. So we mentioned a little bit about funding and supportive funding. It's to try to maintain and sustain our sign-on program long term. So hopefully we call this a pilot, but I like to say, no, it's a program, and we're going to constantly, continuously support it. That's
There's
it.
very wide range of obviously different services available to New Yorkers with and without disabilities, which is fabulous. You mentioned ticket to work a little bit. I don't know if you feel like when a person that has a ticket, could you possibly maybe explain to the audience just a little bit of the basics on the ticket to work? Is that something you feel comfortable with doing?
Sure,
I know
sure. They can come in. With a ticket to our DRCs, we have so not all of our DRCs are benefit advisors. There's I think it's 23 out of our 24 out of our 27 are benefit advisors. So they can come in, and the others are working on it. So they can come in with their ticket, and we can work with them on that. Certainly people may not understand the process, and we can sit down with them and understand that, and really kind of go over. I think it is the report mentions the benefits cliff. People are scared, right? They're afraid they're going to lose their benefits completely. So we can go over that, and then you can give out projections of what they're going to be doing. So looking at, okay, what is it that you want to do, and then salary wise, financial literacy, all those kinds of things are critical for somebody to make a decision, right, in getting back to work. And I really liked the report myself, looking at, I like the charts. I'm a visual person, so seeing the charts and examples of when people go back, I think is critical, and that's what the DRCs can do as well. And it is a family process, so it's working together, and kind of that IRT model, as we mentioned, is a great way of working like holistically with the person and their family.
Kerry, thank you. That was fabulous. That was really good. We're going to be doing some Q&A kind of at the end, so people please feel free to put some questions in the chat, right? And we're kind of tracking those, and we'll be able to kind of organize them and answer questions as we go. So the way we thought we're kind of moving this, right? So you're hearing from the Department of Labor, which is all over New York State, right? So there's every part of the state, there's going to be a Department of Labor office. There's going to be some way for a community member to be able to kind of access information for that. So we're taking this, so if somebody doesn't have a job yet, they're coming in the system, or maybe they lost their job and they need another opportunity, they might be at the Department of Labor. There's other pathways and doors as well, and the Department of Labor and the Access VR and the Commission for the Blind vocational rehab services will oftentimes work very closely together. So next up is Ann Gallagher-Saagas. I hope I got that right, the way I said it, is the Upstate Regional Coordinator with the New York State Commission for the Blind at the New York State Office of Children and Family Services, OCFS. Ann has been with the Commission for the Blind for 6 years, previously served as the District Manager in the Albany Office of the Commission. Previously, she worked as a social worker and rehab services manager of the Northeast Association for the Blind at Albany, NABA, for 20 years as Upstate Regional Coordinator. She works with the Albany, Syracuse, and Buffalo district offices, quite a few, and on direct service provision, policy implementation, and development of programs. Welcome, Ann, and the floor is yours.
Thank you very much. Thank you, Steve and Leigh and the Rockefeller Institute and my fellow panelists. I'm very happy to be here today. Obviously, this is something core to our mission at the Commission for the Blind and Access Voc Rehab. So just to talk a little bit about, I think most people have heard of Access VR if they work with employment and people with disabilities. And a lot of times we're the kind of forgotten sister agency, the Commission for the Blind, but our placement employment programs, our funding is primarily through federal funds. We're under the Office of Children and Family Services, the Commission for the Blind, and Access VR is under the Department of Education in New York State. But we really provide the same services in terms of vocational. How it differs between the Commission for the Blind and Access is if somebody is legally blind or is currently working and has a vision condition that their doctor verifies that it is expected to worsen in, a specified amount of time. For those individuals, they get referred to the Commission for the Blind for services. Another way that our two agencies differ is the Commission for the Blind is known as a birth to death agency, whereas Access VR is primarily transition age and adults who have an employment goal. So we are at the Commission for the Blind able to also provide services to children and adults, adults who don't have an employment goal or who have retired. So we do provide some specialized vision rehabilitation services to those individuals, and that's through state funds. But we're here to talk about employment and voc rehab today. So I thought maybe it would be helpful to just kind of give an overview of what it looks like when somebody applies for services. I'll speak from the Commission for the Blind, but it's very similar for Access VR. Our primary mission and goal is to, help an individual with a disability or who's legally blind to either retain employment or re-enter employment or get the proper training so that they can, become employed. So when we first get a call or an application, either through a doctor or the individual themselves or a family member, anyone is welcome to contact us, and we will, walk the person through the application process and verify, their disability and that, what their interests and goals are. So across New York State, for the Commission for the Blind anyway, we have 7 district offices and several outstations to cover the entire state. So depending on, the county where a person lives, they'll get assigned to that district office and assigned a vocational rehabilitation counselor who will contact them and set up an in-person meeting to really just get the, full picture of the individual. We have a very individualized services based on, what the person's goals are, their needs. Especially with vision impairment, we're working with people who were either born with a vision impairment or who have acquired the vision impairment over time, sometimes suddenly. That can be the case with any disability, obviously. A lot of disabilities are unseen, that aren't as obvious to people, but depending on, what that person's disability is, how they've come to be seeking services from us, they, may be going through a significant adjustment to the disability, or to, maybe they've been out of work for a long time and now they want to go back to work. So our services are really tailored to, meet the person where they're at and, figure out, okay, what are your goals? How can we help you attain those? So the vocational rehab counselor is going to work very closely with that individual to map out what those goals are, and then figure out what are the services we can provide to you, which are quite vast through VR. Thankfully, I mean, we can, from nuts to bolts, help somebody to, get where they want to be, and the voc rehab counselor's job really is to, help to advise and to, help with establishing realistic goals, but it's the individual who's driving that. So at the Commission for the Blind, we work with a lot of community rehab partners that are specifically for working with people with vision impairments. And I know Access VR also has many different partners in the community that work directly on employment for people with disabilities. So some of the services we might, set up for a person would be definitely independent daily living skills instruction, if that, especially in the blindness world, we have specialized instructors to teach orientation and mobility to make sure somebody can, get around. First, you got to be able to do everything you need to do on a daily basis in your home before you can even think about, for anyone with a disability, before you can even think about, going out into the workforce. So whatever special training or equipment a person may require to do everything they need to for, meal management, communication skills, financial management, we'll provide those services, as well as getting around safely in your own home environment and out in the community. So we have specialized instructors that will, teach somebody how are you going to get to work every day if you can't drive anymore, so learning the bus route systems, how to safely cross streets, whatever it might be. We also have partnerships with the independent living centers that will provide benefits advisement, what we're here to talk about today, which, as everyone I'm sure is going to mention, is often one of the biggest barriers to getting somebody in, who's on SSI or SSDI, or who's had to stop working, back into, not afraid to, seek out employment. So we will work with the independent living centers and their staff to provide benefits advisement to our participants. We have social workers that we contract with that can just go over all the different resources and, just like Kerry mentioned, but whether it's housing, insurance, benefits advisement, all the different things that a person is going to have to navigate, and so we will support them in those pursuits. So those are some of like the core services initially. And then once a person, okay, I'm dealing with my disability well, I feel like I can navigate what I need to in my day-to-day personal life. So now maybe we're going to focus on either an employment training program, or maybe they're ready to go into the workforce, or they may want to go to school. And we can provide, for people who are economically eligible, we can provide tuition assistance for most training programs and, colleges, and to further their education to meet whatever employment goal they have. So in terms of employment services, we're going to work very closely with the Department of Labor and the workforce centers. That is part of our contracts that we have, right, part of WIOA, but also part of the Commission for the Blind contracts that we have with our partner agencies that provide placement services. So we require that employment specialists are and either the employment specialist is going to do it, or the voc rehab counselor will work with the individual to get signed up with the Department of Labor, go to the workforce centers, and take advantage of all the different programs and services that opens up to our participants, and to keep that partnership strong. One of the initiatives that the Department of Labor and VR had a few years ago and continues to have is making sure we have adaptive equipment at the workforce centers, so that any participant that comes in, even if they may not have an open voc rehab case, but somebody may come in with a certain type of visual or physical disability and, need assistive equipment to help them with that. So every workforce center has gotten a package of equipment that I think is going to be getting updated, or probably needs updates by now, but that either has, so that they can go in, and just like anybody else, it's accessible to them to use the information that's there. So that's another way that we've partnered. But in terms of, other employment services, resume writing, cover, or, job searching, how do you job search, just work readiness programs. We have some, we do a lot with youth in transition for work experience training programs, where we can work with employers in the community and pay the salary for somebody who is maybe new to employment, working for the first time, or maybe we're not sure if the job can be made accessible to the individual. So we can do some short-term work experience trainings to determine if it's going to be a good fit. We do on-the-job trainings, work tryouts, internships, paid internships. We have lots of different employment programs that we can gear individually, again, towards the person and what their needs and wants are, and have a network of employers in the community to it kind of helps them to, if the employer's nervous about it as well, this is a nice soft entry that we can help to supplement some of the costs of the salary initially to get somebody in the door. So trying to think what else. Job coaches, that's another big piece of making sure somebody is going to be successful on the job. We can pay to have some short-term job coaches in place in the beginning. Yeah, and a lot of different equipment. I can go on and on and on, but
and so that's a very wide range of services, and in a lot of ways similar in some ways to what Kerry was talking about with the Department of Labor. Are there times in which an individual has to choose between, should I be supported through Department of Labor Services, or should I be coming to Access VR? I think more Access VR than probably the Commission for the Blind, based on the the wide scope of needs that person may have or at the commission. You know, you kind of went through a lot of things from, you know, the travel and the safety issues and the different assistance that you can provide to somebody that has that high need with that. What about, so for like Access VR and DOL, are there times people go to both, or are there times they have to make decisions?
You don't have to choose one or the other. Sometimes, I don't know as much about the ticket to work. Sometimes the ticket to work has to get assigned to one of the agencies, but no, you can, our services are designed to complement each other and for us to work together. So of course, I would say do make sure you get signed up with a voc rehab counselor, because they're really going to be, you know, supporting you the whole way through, and they can help bridge that relationship with the workforce centers and the Department of Labor. But no, you don't, we work together.
Okay, fabulous. Kerry, anything that you would add on that? The notion of that coordination
yeah,
of service?
just same as what Ann said, is that, you know, we work together. I think you sometimes folks will come into a career center not knowing what services are available or that they have these opportunities, and so we try to figure out what we're best to refer them. So we can do that, because again, anybody can come in or be referred. So we generally try to do a tertiary, you know, assessment first, and that might be the regular frontline staff first, or, you know, the DRC will then assist folks if they're not sure where to go. But we can definitely then refer them. And then as far as tickets to work goes, right, they could start somewhere and then end up going somewhere else with their ticket when it gets assigned, and that's okay too. They have that option. So, because it may make more sense if they decide, you know, I need specifics for this for access, you know, so and that's it is what it is. It's one big happy family. We just want to serve the customer in the best way we can.
Yeah, and it's their choice. You know, like I said, sometimes people, for whatever reason, don't want to sign up for voc rehab services and go through our process. That's okay too. And, you know, if they just want to work with the career centers, that's fine too.
So as we kind of move along, so the New York State Department of Labor, New York State Office of Children and Family Services are state agencies. There's organizations operated by the state of New York at different ways and means, you know, throughout services for the community to assist people. Oftentimes the way in which, like, I'm going to speak for an Access VR for a second, is going to work with a lot of community members and a lot of people with different disabilities is through a contracting process. And the Department of Labor may do a similar thing, a contracting process. So an agency like one I work for, AHRC New York City, Goodwill and GoodTemps, Center for Disability Services, oftentimes are in contract with Access VR or the Department of Labor to deliver certain services and to assist people, right? So as we kind of move this along, people are getting front end services, some assessment determinations of what services they're looking for. Access VR may now refer somebody to a different organization. It could be to one of our organizations or any one of another 100 different organizations across New York State that can provide services for people to assist them in their employment goals, kind of with that. So as we kind of make this move, I'd like to introduce now Greg Sorrentino, who's currently the president and chief executive officer of the Center for Disability Services, which he began that role in 2019, but he's been with the organization for over 30 years and has a world of knowledge and experience, both programmatically and from the financial end. Greg, welcome.
Steve,
Can you
thank
tell
you.
us a little bit about yourself? Yeah.
Yeah. So as you outlined, I've been with the Center for Disability Services for over 30 years. In the center, I mean, a lot of what's been talked about, the center does, and we have really within our organization. We have two areas that we do a lot of this type of work, and one of them is around our work with NYSID, and actually that goes through both of these agencies as well, and that's in our mail fulfillment center. And the other piece would be what we have done internally is we have taken a number of employees and used them in a capacity of our own little maintenance and housekeeping services within our own organization. We have a lot of different sites. So we have a lot of this built into our network and into our own internal systems and structures. And, if we talk a little bit more about the benefits side of it, and how do we keep people working without having to run into some of these hurdles. We can get into that as well if you want to do that.
Yeah, that would be great. Greg, maybe you could start by, could you maybe give the audience here a little bit of sense of what is NYSID? You mentioned NYSID. It was mentioned a couple of times earlier. I mentioned it. Leigh mentioned it. You've mentioned it. We all are NYSID members, and NYSID is very, very important to all of our organizations. Our organizations, AHRC, the Center, Goodwill, are private not-for-profit organizations, so different than state organizations or state-funded agencies with that. But it might be helpful for people to understand a little bit about NYSID.
Sure. So NYSID is really the organization who helps procure many of these contracts that involve individuals with disabilities. And in turn for those contracts, and many of them are driven by state or municipal government contracts. And the trade-off to that is that there's minimum labor hour standards that have to be met, and that's the qualifying component to getting this work. So, New York State Industries for the Disabled is a partner of all of ours. Steve is, I'm on the board of NYSID, but really they're a partner. And when you collaborate and work together in identifying the proper work for the individuals that you have within your organizations, they're a great partner to work with to try and then identify work that's available throughout the state of New York. And it becomes a nice fit, and it becomes a tremendous opportunity for people to have work opportunities. I think we said earlier, and if we didn't, we should, that 67% of the individuals in this state with a disability are also unemployed. So it's as every organization struggles with trying to find workers, there's a whole bunch of workers that are available that often aren't looked at as potential solutions to whatever needs you have. And I think New York State Industries for the Disabled has really done a tremendous job of not only in government going out and reaching out to private organizations to help them better understand that there's a whole nother workforce that no one's looking at that are very capable of filling many of the needs that these private organizations have. It's not just doing state work. You can do private work as well, and these individuals are more than qualified to participate in those contracts.
That's great. That's a great explanation. Do you want to talk a little bit more about, the work at the center, maybe even like a little bit who goes there for services, what types of things they're doing, and what types of benefit advisement might be available to them?
Sure, be happy to. So much of the work we do is around mail fulfillment. So that can be printing, inserting of documents, mailing of the documents. So some is just the mail. It gets printed elsewhere and brought to us, and we sort it, insert it, sort it, and mail it out. Some of it is sent to us in electronic files in the cloud, which we download, print, insert, and mail. There's a lot of different components to that. So and some of it is depending on the size of the envelope. Some of this is all manual work. Some of this is even on the machines. What we found unique here is many organizations automate to try and reduce the workforce. We do the exact opposite. We automate to try and increase the disabled workforce, to be able to offer opportunities. The faster the machines get, the more people you need to help either load the paper, envelopes, take documents off, put them into the sorters. There's a million different jobs associated with that. And for us, that has been a major source of our employment. We do about 60,000 hours a year of disability hours alone within that mail fulfillment center. And for many people, and so some people live with us, some people live with other organizations, some people live in the community. So it's not that you have to be in one of our homes to participate in this workforce. The opportunities present themselves where it's individuals who could be living home with their families or living independently, or they could be living in another organization's homes, or they can be living with us. It's really it's just an opportunity to provide in a workforce that's A, integrated, which I think is the best part of it, and B, allows for the right amount of support. And this is on the work side, that, you know, some individuals need less support than others, but the only way that any organization is successful is to be able to provide the level of support that someone needs. These aren't charity jobs. These are real jobs. There's expectations, there's job descriptions, there's evaluations. So our job is to make sure that as these individuals come into this system, that we have the right amount of support to make sure that they are successful throughout the system and hopefully move to other jobs and do other things all around that support. Now, on the benefit side, which I think part of what we want to talk about today is how do we set that up? We have a large system here, so we have the flexibility of doing a lot of this in-house, but we have, at the beginning of the year, we try and evaluate who is working, who's likely to work, and start to look at so let's just use the example, they live in our homes. So we have the residential management team, we have our own benefits coordinators, we have the job coaches, we may have families involved, obviously we have the individuals involved, and start to chart out for them how many hours they're able to work to not have any type of benefit impact. I think some of the things that go a little under the radar, I believe now, I think the state of New York has gotten, through the buy-in program, has gotten a little bit easier and better around not having those income limits start to impact benefits. But I think on the federal side, that's not always the case. And I think one of the areas that goes a little unnoticed is under the SSDI, that you do qualify for Medicare after, I believe, 25 months. And so if you lose your SSDI, you also lose your Medicare on top of it. So those are the things that no one ever really talks about, but those are the things that really can impact an individual tremendously. If you lose your, a lot of that SSDI is around your rent, and also you lose your Medicare on top of it. Those are two tough areas to be able to, and that's where and I know it's been mentioned a few times, individuals get scared. Well, anybody would get scared if you have those types of challenges sitting in front of you. I think the other challenge that has come up is, with all the ARPA money that's been in the system, bonuses do count against these income limits. So it's not just your wages. And I think as much as we do planning throughout, especially at the beginning of the year, but we do monitor it throughout the year, the one thing that's hard to plan for is a bonus announcement. Again, in the last couple of years, this has been very, very prevalent around the ARPA funds. It's hard to plan for something you don't know is coming. And in these last couple of years, those have been relatively large amounts of money. So I think I could just speak to 3 cases that we know of in particular that really took a lot of work to be able to get these individuals back into the system. And not, they did end up losing some benefits temporarily, but we were able to do some things to prevent that from going on for a long period of time. I think, here, what we try and do, again, in all this planning, we have trust opportunities, we have other opportunities to help people manage it. And I think what we try and do, again, with all the right supports in place, is to make sure that we really look at an individual in advance and try and chart out for them so that they take some of that fear and anxiety away from being able to get a job, be able to lay out with them, with people who know how to do this stuff, be able to lay out for them that it's okay for you to work. It's okay for you to make this amount of money. Here's how we can do different things to make sure that you're not, you're not impacted in a negative way for a very positive thing, which is working.
I think that was a great way of saying that. 'Cause it can be very scary, obviously. But when you put the numbers together financially, you pretty much always work out better working with total dollars coming in than not. So, there's always there's certainly that upside. So employment for people with disabilities, or anybody, honestly. So our organizations oftentimes have different approaches to helping people become employed. We can do a direct placement, placing somebody on a at the Hilton hotels or at Barnes and Noble, or, you know, Macy's, or whatever it might happen to be, any kind of business, and the person becomes an employee of that business. There's also contracting, and NYSID is oftentimes contracting. So we're contracting services. So AHRC does janitorial work, a lot of janitorial work all throughout New York City, like at the MTA and fire department and places like that. We have a contract. NYSID holds the contract with the MTA in this example, and through that process, we are then a subcontract to NYSID. Then the workers that we are able to put to work, and these are great life-changing job opportunities for people with disabilities and for anybody, because they pay really well in New York City. Janitorial industry is a prevailing wages. You know, there are people are earning over $25 an hour. They're really, really good jobs. And kind of with that, but they become employees of AHRC New York City in the subcontracting kind of arrangement. And now we're going to kind of shift gears one more time, and we're going to go to Derick Bowers, who is the executive director of GoodTemps. And he's going to explain a little bit about GoodTemps, a staffing agency of Goodwill Industries. Goodwill is national, as I think probably everyone probably knows. This one is Goodwill Industries of Greater New York in northern New Jersey, where they help over 500 temporary workers, most of whom are people with disabilities. And maybe you can explain a little bit about the ratio aspect with NYSID contracts too. That'll probably be helpful and interesting to people. Derick has over a decade of experience in the nonprofit sector, specializing in social enterprise workforce development. So welcome, Derick. Thanks for being so patient and being the last one up today, but the floor is yours.
Yeah, thank you, Steve, and thank you to the Rockefeller Institute and all of my fellow panelists here to talk about these important issues. And so, you know, just want to briefly talk about GoodTemps. I've been at GoodTemps for the last 6 months now, and prior to this role, I've worked in a various of spaces helping underserved populations get access to work, whether that be folks who are homeless or individuals returning home from incarceration. And what you find is a lot of overlap in, you know, issues that affect people who are underemployed, chronically or otherwise. And so with GoodTemps, you know, I have the opportunity to, you know, serve mainly individuals with disabilities and other people with barriers to employment, getting access to temp work through many of our customers, primarily are New York state and city agencies, and through our partnership with NYSID, which allows us to be a #1 preferred source for the procurement of temp services. And to speak about that disabled labor ratio, you know, through our contract with NYSID, you know, we have to be able to ensure that at least 50% of the individuals we place in temporary employment have a disability. Currently, we always stay around 75%. And so when you talk about the 500 individuals plus that we have working every single day, you know, nearly 400 of those individuals have a disability. You know, we've paid since, you know, 2015, we've paid $92 million in wages to individuals with disabilities, and we've placed over 2,600 individuals with disabilities in temporary jobs. And we've also been able to ensure that our customers, many New York City agencies, have hired almost 250 individuals with disabilities permanently. And so when we talk about temp work, which many private temp organizations are focused on placing bodies and maybe not as person-centered, you know, our goal is to provide a true career trajectory through real-time training with the customers that we're serving, and ensuring that those customers have access to best practices, and also understanding the mission, right, is to ensure that these individuals have access to the power of work. And, you know, the benefits conversation and the benefits cliff conversation is really important, because there are a lot of myths that are out there that scare people from working, and also scare people while they're working, right? And so we've had many situations where, you know, for example, individuals on SSDI, you know, choose to work through GoodTemps, And just for context, a lot of times our temporary employment is not necessarily temporary, right? Many of our agencies utilize our services and extend these temporary workers, 6 months, 1 year. We have individuals who've worked over 2 years in a position. And which could lead to permanent employment, which could lead to permanent employment at other agencies based on the experience that they're receiving, and other factors. And so when you have individual SSDI who was working, and that 9-month kind of threshold comes up, right? We have many individuals who have just ghosted work because of their fear on what would happen to their benefits. And so for GoodTemps, we don't necessarily provide benefits advisement. We have other departments in Goodwill that support that, right? And we partner with those departments to ensure that individuals who are registering with GoodTemps, who are interested in working, can understand what they're getting into, can understand how their benefits will be impacted. But what we see is that benefits advisement is hard, it's complicated, and it's expensive, right? And so for us to fully support individuals who are walking in our doors every day, hoping to gain experience through our temp work, being able to get them in front of someone that's going to provide very thorough advisement, and then also understanding through, our WIPA grants. And I know, Steve, Towler, you can probably go into more detail about, what that is. But for us, with the WIPA grants, we, Goodwill serves about 10 counties, right, throughout New York and New Jersey. And through our WIPA grant, we can only provide benefits advisement to individuals who live in 4 of those counties, which is extremely limiting. And so when you have individuals coming to us throughout the state of New York, right, interested in working with GoodTemps and have concerns about their benefits, if they do not live in those 4 counties, we really can't do much with them in terms of providing really thorough advice, right, around their benefits. And so that is, kind of one of the many examples on why, it's important that we get more resources when it comes to benefits advisement, and more funding around that.
Completely agree, Derick. And just from a quick look up, just so WIPA, we do not have it ourselves. My organization, I don't believe Greg does either, but others do. Work incentives planning and assistance, right? And it came to life in the Ticket to Work Incentives Improvement Act of 1999. So it's been around for a while, kind of with that. But it certainly is. I think you nailed it. Benefits advisement can be hard, complicated, and expensive, right? And I think one of the other kind of variables that is significant in our field these days is the high turnover rate of staff, whether it be a direct support professional, whether it be a social worker, rehab counselor, whoever it might happen to be. As they leave the field, they leave with knowledge. And sometimes it's somebody that maybe was trained and certified in benefits advisement. Sometimes it's not. Sometimes it's somebody that just knows the system really well and understands it, and is sometimes good at math, right? I've heard people say that I don't really understand math. I can't do this. It's the math is not that complicated if you pay enough attention to the explanations, and there's programs and everything. But it really is kind of understanding the eligibility requirements of these programs is complicated, right? And it can scare people out of there. Can you maybe, Derick, talk a little bit more about, what you guys do there and people that are supported, and, even how maybe you work with Access VR, just how the system comes together?
For sure. Yeah. So, we have a very person-centered process where, as soon as you're interested in joining GoodTemps, we get you in a system registered, and fortunately we are launching a brand new system called G-Talent, which is basically Microsoft Dynamics applicant tracking system. It's a really good system that allows us to really bring in talent, right? But also help us place talent with many of our customers through a very connected process. And so individuals register with us. We need just the bare minimum information, your name, kind of, do you have a disability? What experience do you have in employment? we get you into the system and going through intake, and intake reaches out to an individual trying to understand not only their experience, but what they're looking for in work, right? What their goals are. And if they do have a disability, we forward them to our voc rehab department that qualifies that disability. And we work with a wide range of individuals, wide range of disabilities, right? And so, whether it's physical disability, whether it's neurodivergence, whether it's developmental disability, mental illness, substance abuse, right? Those are many of the things that qualify on the NYSID for having a disability and being able to take part in our affirmative action program, which we prioritize individuals through that program for our disabled labor ratio. Internally, we want to keep that ratio as high as possible. Right now, as I mentioned earlier, that is 75%. And so once that person is qualified, a disability is qualified, we can then ensure that they're work ready, obviously completing an I-9, making sure they're able to work in the United States. And then we send them over to our placement team, helping them match to many of the jobs that we have available from our customers. Through our NYSID contracts, there are over 300 titles that we can place temp workers in throughout many of these agencies. And so, we used to say, we hire people from labor to lawyer, right? Because that is the gamut of work and opportunity that we have. And so, I saw a question in the chat regarding are we just putting people in janitorial roles or, kind of like basic labor roles, but for us, and while those roles are great opportunities for people who need them, we also have the opportunity to place people into high functioning roles, data entry, paralegal, accounting. And so this gives great access to people with disabilities who may have experienced stigma or the barriers to finding these kind of employments or finding employers who can be accommodating based on disability. And so, and that's just a quick summary of kind of like what we're able to do and what we're able to provide.
I think when you just think a little bit about the employment landscape, right, that's been kind of outlined, the unfortunately, the vast majority of people with significant disabilities are not working. All right. And I've been at 35 years plus trying to do this, and I think we do a pretty good job of it. But as you look at like big picture numbers of people still not working, things like that, it sometimes looks like, well, what's happening? Are we able to help anybody? When the reality is we are, right? But the numbers, given the need and that exists out there, the number of people that need services, the number of available resources to help everybody, it's a mismatch. So there's not enough resource in the system. There's a multitude of issues out there. There's all I mentioned earlier. There's a whole different ways. There's many ways to help people go to work, to prepare for, obtain, and maintain employment in the community. When I began doing this work years ago, we had a couple of program models, but it was all the same. It was still we're helping people prepare, helping get a job, and then helping you keep a job, right? And today you can dress it up in a lot of different ways and a lot of different services and programs, but it still boils down to the same thing. How do you help a person get ready for a job? How do you help them get a job? And how do you help them keep a job, right? It's kind of sometimes some fancier names and ways of doing it, but it's still the basic bottom line. There's so many people that want to go to work. Sometimes there's not enough job opportunities and businesses that are supportive and kind of opening their doors. Can people maybe want to address a little bit that, and maybe so many interesting ways, whether the Department of Labor, anyone that's kind of found some good ways to reach out to businesses to help people go to work? Anyone want to take a crack at that?
Sure. I think, well, for us, I'm sure everyone will pipe in. When we go out to businesses, we have to kind of dispel the myths, right? So that's a big thing, is dispelling the myths. And we even have fact sheets on that. And I think that's constant. And then also, trying to do some job development for folks, because sometimes there's definitely accommodations that need to be made. And it may be not just something that's physical, it may be time. Or, depending on what's going on with the person and what they're specific needs are, you really have to kind of develop that. And it is a slow process. It's not, not every business can handle that depending on how their business runs. So you have to really look at the individual and then where they can be working. When you think about we've talked about autism, it has to match, right? Because some physical areas are not going to be necessarily appropriate. So it has to be center-based, person-centered based, and with businesses, it's really advocating, and all of the success stories that I hear with businesses, I will say the best advocates are the ones that have disabled children or disabled in their families. And you'll notice big businesses who are probably one of the best in employing people with disabilities understand it, they get it. And so they understand it's not, it's not that hard to make accommodations. But it is, you have to keep working it.
Without a doubt. And marketing, reaching out. Go ahead, Derick.
For GoodTemps, I think that we find what is most helpful is understanding the accommodation needs from our candidates, right? And so when they're registering and they're going through the intake process, we want to know what those needs are. And when we are, submitting opportunities, and from our customers, part of those opportunities and the information that our customers have to tell us is what is the environment of these jobs? Is it a high stress environment? Is there a lot of noise? Does it require for you to stand up for a certain period of time? So many different check boxes that we, our customers will check off so that we have a really great understanding of the landscape of each opportunity so that we can match to the individuals that we can match to based on the accommodations that are needed, right? And so that's, the businesses and our employers have to have the knowledge for accommodation, but we also have to have an understanding from our candidates as well on what their needs are.
Great, thank you. Greg, you want to add anything to that?
Yeah, I think there's a couple things. One is maybe now more than ever with employers having less staff in the office, I think there's a concern that I don't know. Certainly the accommodations are always a concern, probably just because they're an unknown. But the bigger concern of that is what if they need something more, and they as the employer don't have that knowledge or experience. And I think one of the things we try and do, two things we try and do is, one is have someone else who has been a success story. So a business leader who has taken this and been successful with it in their own business, let them be a reference or a phone call to someone saying, hey, listen, I did this in my business and I'm better for it. Our organization's better for it. The other thing is to make people understand that we have supports that go with them. So if there's a problem, they don't have to deal with it. That's what we're here for. We're here to bring someone in behind to work with that. But again, I mean, Derick outlined it. You got to know what the stress points are going to be in these jobs and make sure that we get whoever we send in there, we have the right person. But sometimes even if you think you have the right person, something else comes up, and they just have to understand that we're not going to expect them to be the one to have to deal with that. Because there's obviously a very uncomfortable situation on both sides with that. And I think what we try and say is, listen, if there's an issue, we'll be the ones who come in. We have somebody there. We have a job coach. We have somebody else who will come in and either say, yes, we can make this work with ABC, or you know what, we can't, but we'll be the one to take the person and put them in another location and then look for another candidate to come in behind them. So I think that's another big fear factor, that no employer wants to take this on, have it maybe not go as planned originally, and then have to be the one to fire somebody or have to counsel somebody. They don't want to do that, and I get it.
Gotcha. Sounds good. All right, Leigh.
Oh, I'd also like to highlight, we had for anyone who's interested specifically in the employer topic, in our cost of paperwork webinar, which you can find the recording of, Howard Gross, president and CEO of eBizDocs, joined us, and he talked a lot about how he, as an employer, works with people with disabilities. And he is not a nonprofit employer. He is a for-profit employer that hires extensively folks with disabilities, and he talks about why that is, how he, you know, runs his business this way. And so I'd really recommend that for especially employers who are considering expanding their hiring in this space.
That's great. So are we now moving to Q&A?
I think we've started.
I think so too, but I think, are there some that you guys were taking a look at in the chat that you wanted to pose?
I'd like to rephrase one of the questions from the chat for everyone specifically, and I think we've already started answering it a little bit. We do have far more unemployed folks with disabilities than unemployed folks without disabilities. And it does not seem like the needle is moving as quickly as potentially it could be, despite all of these services. How do you all measure success in your efforts? What would you see as moving the needle forward? What would you see as a win? Other than obviously preparing people for jobs, getting people jobs, and keeping people in their jobs. What looks like a macro level of success?
Looks like Anne wants to answer that question.
Well, I'm
It's
thinking,
not an easy question.
no, it's not. I guess I would just say, like you, Steve, I've been in this for a long time. And one of the questions that I get, you know, family, friends, people in the community always is, well, what kind of job can somebody with a disability do? And it's always the, what kind of job can they do? And it's like, no, that's not how I know. It's what does the person want to do? How can we, you know, make it accessible? And I know that's very Pollyanna and big picture, but I really do think when we can start breaking down just some of those long-standing barriers within the community themselves, you know, like I said, lots of times we're working with people who've acquired a disability, so they have their own biases about what having a disability means and their ability to do things. So success for me, well, obviously is moving that needle. And once I can get, it's more 70% unemployment rate, I want to get past that. But definitely just when that's the question that people stop asking me, like, what can somebody who's blind do? It's like, oh boy, okay. That's success for me.
Anyone else want to? Greg or Derek want to take a shot? Can mean a lot of different things in so many ways. And, you know, you hear it thought of as it one person at a time. You know, we helped one person get a job today. You know, it changed that person's life. We fulfilled the contract. You know, I mentioned earlier that organizations like an AHRC New York City and all the ARCs across the state of New York and Greg's organization and Derick's organization are going to have contracts. The contracts have goals, you know, to achieve success as well. Some of the goals might be to, you know, put 50 people to work this year, you know, and you get X dollars in return for that, right? Is success fulfilling that contract? You know, is it getting a new NYSID contract that's going to help more people go to work? I think there's just lots of different ways to kind of measure this. But you're right, Leigh, the needle has not moved a whole lot. And that's really scary in a lot of ways. Why is that? You guys want to take a crack?
Yeah, for GoodTemps, Goodwill, you know, and this is more of a downstate focus. You know, the city administration, you know, prior to the budget cuts and the fiscal crisis that is happening, you know, talked about this huge investment into making sure individuals with disabilities have access to fruitful career opportunities, specifically through the city, right? And so because GoodTemps has this infrastructure where we already have, you know, well over 300 individuals with disabilities working at these agencies from a temporary basis, how can we convert these to permanent hires? How can we get people into city jobs and access to middle class, right? Which is life-changing for so many people. And so, and I think that there's opportunity for more collaboration and creativity with the city and state around how we can do that and use government as a vehicle, right, for this to work. You know, and so and then also, you know, for GoodTemps, you know, is elevating the journey of our candidates with disabilities. How can we make this not just a temp journey? How can we utilize GoodTemps alumni to come back and be peer mentors? You know, there's so much more we can do to make our very person-centered organization be even more person-centered, and utilize the voices of individuals with disabilities in making things better.
I actually think that segues really nicely into one of the questions from the chat specifically about, it's about a specific person, but I'm going to generalize it a little bit. How, once someone has a job, right? That's step one, prepare someone for a job. Step two, get them a job. Once someone has a job, especially if they relied on a job coach in the initial phases, you know, how do we work with folks to maybe phase out those job coaches to find more traditional career mentors in their positions and generally make that more cultural transition rather than just a benefits transition as well? Any thoughts?
I mean, look, I look at this, and I think we look at this as like anything else. I think you have to start somewhere, and the starting point, at least how we've always seen the starting point, is most of the time it's education. You have to educate people on what exactly we're trying to accomplish here. And I think for years and years we were given things because you know, people felt like it was the right thing to do. And I think what we've tried to do here, and when we meet with people, is show that these are individuals who have every bit the capability of everybody else. They may need an accommodation. They may need someone, you know, someone there with them occasionally, whatever it is. But I can tell you, in our place, we do annual evaluations. We have the same expectations of the person who's disabled as the person standing next to them who may not have a disability. We don't look at it that way. We set expectations, and then it's our job to get those individuals to that level. That's our job. And I think once you do that and accomplish that internally, then you go back out to the community and you set those same expectations for whoever you're going to put in somebody else's building or somebody else's space. And that expectation, as you said, it should be to move someone down the field, right? Get to the next step, get to the next step. And that step likely is to reduce the amount of involvement from a job coach or any other situation that you've had to put in the beginning to help somebody be successful. But you know, I just believe that we have to look at this the same way that we look at everything else. You have to set an expectation, and then there's really two parts to that. There's the individual, and then there's the organization that's behind them. And both of them have to have a commitment to get that, you know, person to the next step in the process. And if you set that up front and everyone buys into it, I think you're gonna have a much higher chance of getting to what you're trying to get to. And the last thing I'll say, and then I'll stop talking, is what does success look like is when people start calling us rather than us calling them for someone to go to work. That is the success point, when you've gotten the community to understand what it is we're trying to accomplish and how our people can be a good fit in their organization.
Yeah. When you suddenly have more opportunity than you do people that need jobs, right? That would be a big change. You know,
Absolutely.
also what we tend to use in the field is what we try to call natural supports. So for people that, you know, we don't want people to have to be overly dependent upon artificial staff supporting them where possible. So we want natural supports to be able to kind of take over, and, you know, as that job coach is providing support and fading out, hopefully bringing in natural supports that are there. Leigh mentioned, like, is it a mentor? Is it a colleague? Is it a neighbor that's maybe works in the same place that's gonna help a person get to the job site? There could be lots of different ways of looking at that. Sometimes it's really successful. Sometimes maybe there's some pitfalls with that. There is some funding in place that helps certain individuals. We can provide job coaching for the life of the person. That is possible to have some high level support for people as they need that. But you still want to help people become as kind of integrated and inclusive in the environment as possible. And a lot of times natural supports will help you get there as well.
Yeah, and I think I'd like to highlight that, you know, as a labor economist who does research on this stuff, mentorship within jobs is not just for people with disabilities. It is an incredibly crucial part of all of our careers. I would not have written this report, and I would not be leading these forums if I hadn't had such a wonderful mentor when I started at the Rockefeller Institute. And it can feel, it's disappointing at best if folks with disabilities don't have access to those same kind of traditional workplace mentorship programs or informal mentorship. And I mean, I think that is definitely a cultural issue that may need to be broken down in certain employers. especially those that have less experience hiring people with disabilities, which is always going to be an ongoing problem. So we have a couple more specific questions as well. One is about the OPWDD employability pledge. Before I ask, the question is about, have any of you signed up for that? But I think this is exactly the kind of audience that knows about that. Does anyone want to talk about what that is? Just to give a little.
Well, we did sign up to it as an organization, which, we work very closely with OPWDD, and they are a big proponent of helping people move towards employment and really kind of supporting the employment first state notion, which is the idea that people with all types of disabilities should really be assisted to try to find a job first, become employed first before any other service kind of domain. I'll be honest, I don't remember all the particulars of the Employment First Pledge, and I didn't pop it up on my phone or anything right this minute, but it basically is to, to give people the opportunity to be able to go to work, give them a chance in the community. And as an employer, really consider and give people that those opportunities. And we do that at our organization. We have a number of people working a lot of different roles throughout the organization, and not just jobs cleaning and things like that. So, we try to really kind of put our money where our mouth is. So if we're going to ask an employer to hire somebody, we better be ready to do that ourselves as well.
Thank you. And the other specific smaller question is for Greg. You mentioned during your initial talk about people who live in your homes. Do you want to just give an overview of your non-employment related services?
Sure. So we run over 50 homes in the community. They are certified by the Office of People with Developmental Disabilities. They can be a home, they can be an apartment, depending on the level of support that the individual needs. So we are, give or take, have about 360 to 375 individuals at any time that live in one of the homes that are certified in one way, shape, or form by the Office of People with Developmental Disabilities.
Great.
Is that the answer? Is that the question?
Nope, that is exactly the question. We're looking
Perfect.
for some. Yes, we were looking for some clarification on the topic.
Yeah, a lot of our organizations have an array of services, and employment historically, honestly, has not been one of the best funded services in the state, and it becomes challenging in some ways. So I think as kind of the idea of more and more people wanting to go to work, and we are seeing that. People coming out of schools, people in the community, that work is a major objective and career goal for so many people, more today, I think, than really ever before. So as we're trying to do that, our organizations are growing in a lot of ways, different employment sectors, and really the state's trying to help a lot of organizations strengthen their employment capability so that they are more organizations out there able to support people kind of heading towards or hoping to head towards work. And being supportive work. I had just like one other question just throw out. I know we're running out of time, but I think it may be an interesting way to end. So, as you read the paper, right, the navigating the benefits cliff, right, you're looking at that. Some of the things that you point out in here is that, for example, in some of the SSI rules, so you have the money you can put in the bank now is still $2,000, which it was in 1989. A number of the rules and regulations that are out there related to benefits, sometimes they're quite old. And I think you could certainly make an argument they're not necessarily always kind of having us all kind of paddling up this river the same way, because they're scary. And that sometimes people say, you know what, I'm not going to go there. This is not worth it. Are there rules and regs that you would recommend changing if we could, related to Social Security and benefits? And that's for everybody. Is there something that you see this when people walk in the door and they get that explanation and they turn around and say, no, I don't want to do this. Like, what could we do differently? What could we be advocating for differently with the Social Security Administration?
I think that, and this is a long shot, and, but, I think that we should be figuring out how we can ensure that people keep some benefits while working, right? It's very expensive to live mostly anywhere in this country, especially in New York. And so when, individuals are trying to make decisions on how they can live, it's not as clear cut you know, as some of these papers and discussions and, you know, one pagers can drill down to. There's so many complex situations and scenarios that are happening in everyone's lives. And people are walking out looking to having to spend money on transportation, having to spend money on childcare, having to spend money on the increased cost of healthcare, right? We need to ensure that people are taken care of, and they have access to live as comfortably as they can possibly can while being productive in our society. And so there has to be some accommodations. There has to be some wiggle room in terms of what we can do, you know, obviously considering budgets and financial constraints that the state will have.
That sounds good. Anyone else have anything they want to add to that?
I think in addition to these forums, we had a lot of just meetings with people in this space. And the biggest fear we keep hearing is loss of health insurance. It's always loss of health insurance. And New York has done about as much as it can do as a state to maintain Medicaid for folks up to $73,000 through Medicaid buy-in for working people with disabilities. That's buy-in is actually a misnomer. There is currently no premium, which folks also don't know because it has the word buy-in in the title. But health insurance loss and employment isn't just a benefits problem for people with disabilities. 17% of Americans say they have stayed in a job they wanted to leave for health insurance alone. Not 17% of Americans with disabilities, 17% of Americans have stayed in a job for the health insurance. So it makes a lot of sense that people with disabilities who receive health insurance through their benefits would be very frightened to lose those benefits, knowing that this is that benefits being tied, health insurance being tied to benefits or being tied to employment is so common in this country. And so I think there is just this huge piece of misinformation that is floating around that results in much more fear than there should be. People should feel secure that they will get their health needs taken care of and be able to, you know, take that risk, take that new job, take that promotion, even if it means losing cash benefits. And they don't, and it's a problem.
So I think we've reached the end. It's almost 1:30. Am I reading this ending line, or is this you?
You can go ahead.
Could I do it? Or is there anything else we wanted to Q&A this, or?
Yeah, does anyone have any last thoughts before we jump off?
I think this has been great. Thank you, everybody. So for all of you here, we've come to the end of the webinar. I'd like to thank you all so much for being here today. Thank you, panelists, and for the informative discussion. As a reminder, the recording will be available on the Institute's website and YouTube. The Institute will conclude this forum series with an in-person forum at the Institute in Albany on Tuesday, January 9th from 12 to 1:30 that will examine policy solutions brought forward by other states and localities to enable individuals with disabilities as they pursue employment. Thank you again to the panelists, the Rockefeller Institute, New York State Industries for the Disabled, the New York Alliance for Inclusion, Innovation, and of course, the audience. Thank you all for being here.
And thank you so much, Steve, for agreeing to moderate this. It's been great.
It was my pleasure. And guys, this was great. And everyone have a great weekend.
Thank you.
Thanks so much, everyone.
Thank you.
Bye.